Hi, I'm Nadia Blanchet. I'm a clinical professor of plastic surgery at VCU Health Systems, and it is a pleasure to review what I think is a very important paper coming out of Stanford. They looked at 243,000 women who had breast implant reconstruction. For many decades, we thought it was important to put the implant under the muscle. Then we figured out, for a number of technical advances that I won't get into, that we could put the implant over the muscle. So those patients, if we put the implant over the muscle, we no longer needed a tissue expander because the skin didn't need to be stretched. So women could now wake up with an implant. We know that from an emotional point of view, they feel much better if they wake up with an implant. We know that it's fewer operations because by definition, you don't need to have an operation to take out your tissue expander. We know that patients have more natural results because the implant is sitting lower on the chest and not up on the chest wall where the muscle is. And so this is a positive. This paper looked at the potential negatives of direct-to-implant. So they looked at cost. It turns out that it's much less expensive to go direct-to-implant than to put a tissue expander in, and that doesn't even count the second operation. The risk turns out to be essentially the same, although there's a slightly increased risk for direct-to-implant. And we looked at length of stay, and it was exactly the same, direct-to-implant versus tissue expander. When we start a new operation, we tend to be very conservative in terms of who gets this operation. But then if you looked at the 8 years, we saw that more and more patients who were diabetic were allowed to have this operation and had good results. And more patients who were overweight were able to have this operation and have good results. At the end of the day, we have an operation that has patients who feel better about themselves, need fewer operations, at less cost, less time off work, with the same amount of time in the hospital, essentially the same risk, and better emotional well-being and more natural results. I'm saying that's progress.